And now with the West Broadway project, I am so excited and so pleased to welcome the minister today to our community of Winnipeg Centre, what I like to call the center of the universe with the most wonderful people ever. The Honourable Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health, to also share some more important news about more investments in our community. Thank you. Minister.
Thanks so much, Leah, and hello everyone. And it's great to be back and here in Treaty 1 and the homeland of the Métis Nation. C'est formidable d'être ici à Winnipeg, and it's great to be here at the West Broadway Community Organization. And thank you, Kelly, for opening your doors to us. And it was great to meet. Where's he gone? Jacob. Oh, get over here. Nickel for the Community Wellbeing and Safety Coordinator, Jacob, for organizing today's meeting. It was great to just even hear a little bit about what you're up to here and the incredible work that you're doing supporting Winnipeggers facing the precarious housing, substance use challenges in West Broadway, and lifting up the voices of people who use drugs. Cette organisation est l'une des nombreuses qui, dans tous les pays, travaille sans relâche pour aider les personnes qui consomment des substances. Je tiens à vous en remercier et je veux que vous sachiez que notre gouvernement est à vos côtés dans l'accomplissement de cette tâche importante. As Leah said, this is a very serious time in terms of the people we've lost and how we need to bring evidence to the approaches that we take in what is the four pillars of drug policy, meaning prevention, harm reduction, treatment, as well as law enforcement. It was interesting with Kelly and Jacob to hear that really the way you work is what years ago when I was the Minister of State for Public Health, where we called the 4 C's, which was collaboration, cooperation, communication, and a clarity of who does what when. And I think that the kind of relationships that you have with the community groups here in West Broadway and the working together, identifying gaps, making sure that you are always knowing what one another's doing and being able to help one another. So it is it is such a difficult time as this tragic overdose and toxic drug crisis continues to exact such a deadly toll in this community and all across Canada. I think that everybody has been touched by this. And I think Leah would agree that when we saw that debate in the House of Commons, it has become not a they problem, but a we problem, an us problem. That almost everyone who spoke in the House of Commons has someone near to them that they have lost, and since 2016, more than 30,000 people have died of an overdose in Canada. In 2021, here in Manitoba, 407 Manitobans alone died from an overdose, according to data from the province's chief medical examiner, a jump from 2020's record number of 372. Avant des vies en danger, nous devons donner la priorité à des changements politiques audacieux et à un continuum complet de soutien pour aider les personnes qui consomment des substances et sauver des vies. I think that when we think about people using drugs, I think it's been really important that we understand that we have been asking the wrong question. Not what's the matter with him, but what happened to him. And that I think that when we think about trauma-informed care, we have to understand that some people fell off a roof and ended up with painkillers and then got cut off and had to go to the street for their drugs. Other people, it's the psychic pain of trauma, of residential schools, of child abuse, and that those people are numbing their pain with drugs and alcohol. And what is being provided, I think, in community here is that sometimes that first trusted person that they can tell their story, that they can actually feel that there is some sort of hope for a healthy life. It is, for people living with opioid use disorder, we know that abruptly stopping the use of opioids without medical supports is neither effective nor safe. And now with the combination of drugs, that with diazepam and all these added additional drugs that are long-acting, it's unpredictable. And so that we actually need the kinds of evidence-based approaches, as we saw here at clinic, in terms of the mobile unit for detox and withdrawal. But it means that in order to truly help people, our approach must include harm reduction, in addition to the prevention and treatment, which unfortunately some people don't seem to be able to understand that the evidence is there. Harm reduction saves lives. The same voices that are telling us that it only prolongs addiction, the fact of the matter is that people who use substances need supports, not stigma nor blame. And they need to be able to build those trusting relationships, that people who care for them and don't judge them, because it is those very relationships that unlock the pathways to recovery. And I think most of you have heard me say before, there is no recovery path for people who are dead. Our job is to keep people alive so that they actually can be able to get to the kinds of supports and services they need. So, as you know, one of the bold policy changes our government has taken to address the overdose and toxic drug crisis is the granting of the exemption to British Columbia to allow adults 18 and over found with up to 2.5 grams of certain illegal substances for personal use no longer have their drugs seized or be arrested or criminally charged. This exemption came into effect in January, and as we are now following carefully the public health indicators, the public safety indicators, that this will provide an excellent template for drug policy across the country. As part of our approach, as you know, we're also supporting community-based projects led by the amazing organizations like our host, West Broadway. Ces organisations sont profondément enracinées dans leur communauté, bénéficient de la confiance de leurs clients et possèdent les connaissances de première main nécessaires pour faire une réelle différence dans la vie des gens. So today, I'm pleased to announce that our government is providing more than $13 million in federal funding for 11 projects in the Prairies, Northwest Territories, Yukon, through Health Canada's Substance Use and Addictions Program. And I'm really pleased that Shannon Nix, who runs that program, the Assistant Deputy Minister, is here, hiding over there. But that again, I think when we look at the $100 million that we were able to get in last year's budget and the year before, that this is out there saving lives, and it is about improving the health outcomes for people who are at risk of experiencing substance-related harms and overdose by scaling up those prevention, harm reduction, and treatment efforts, including access to a safer supply of drugs. Cela comprend les jeunes, les peuples autochtones et d'autres groupes méritant l'équité. This investment is part of our broader commitment to make quality treatment, prevention, and harm reduction services more accessible to everyone who needs them, and trying to get them at the time they need them. We know there's sometimes a window where someone says, "Where's the Suboxone lady?" And that we actually need to be able to move at that time, to be able to get people the help they need when they need it. Safer supply programs, increased naloxone access, increased options for opioid agonist treatment. Drug checking technologies, supervised consumption sites are essential elements of the comprehensive approach we are taking with our partners, and that is the SUOP program of Substance Use and Addiction Program. Nous travaillons également avec les provinces et territoires sur un système de soins multidisciplinaire, transformateur, qui intègre des soins de santé mentale et de dépendance centrés sur la patient, tenant compte des traumatismes et culturellement pertinents dans notre système de soins de santé universel, afin que personne ne soit laissé pour compte. From increased access to mental and substance use services through primary care, to improved data and better sharing of health information, and especially disaggregated data between providers, these tailor-made bilateral agreements with the provinces and territories will need to improve the access to the supports Canadians need when they need them. They will also reduce substance use harms, prevent overdose, reduce stigma, and help save lives. So we are committed to continuing to work with all orders of government, stakeholders, people with lived and living experience who teach us so much, and organizations such as yours to develop the bold and comprehensive drug policy and programs that will save lives and help ensure that all Canadians are supported on their journey to become their best possible selves. Ensemble, nous mettrons fin à cette crise. I would like now to invite Executive Director Kelly Fraser to the podium. Thank you again. Merci, Marcy Miigwech.
Thank you to Minister Carolyn Bennett, not only for being here, but for your government's commitment to harm reduction. And special thanks to the harm reduction leaders in our community, such as the Manitoba Harm Reduction Network and Sunshine House, and all the peers working every day to keep each other alive. There's people doing really wonderful, important work in the community, so we definitely wanted to give a shout out to them. The reality in Winnipeg is that every day, people are dying because of the toxic drug supply and the lack of access to harm reduction supports. All these deaths are preventable. Harm reduction supports have been under-resourced and are badly overstretched. It is heartening to see the federal government's commitment to harm reduction that Minister Bennett is announcing today. Harm reduction is evidence-based and plays a crucial role in addressing the toxic drug crisis, poverty crisis, and the homelessness crisis our city is facing. Thanks to funding from the federal government, West Broadway Community Organization will have 2 part-time harm reduction workers who will work together with our partner organizations to expand harm reduction street outreach capacity in the community and to expand our community's capacity to prevent and respond to crisis situations among community members. So once again, thank you very much for the support. It is greatly appreciated.
We will now proceed to questions from journalists in the room. Please state your name, media outlet, and whom your question is directed to. So, Minister, if you wouldn't mind going to the front there. You will have the opportunity to ask one question with one follow-up. Let's proceed to the first question. Et nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquer votre nom, votre média et les destinataires de votre question. Vous aurez la possibilité de poser une question avec un suivi. Nous allons passer à la première question.
Good morning. My name is Katrina. I'm a reporter with the Winnipeg Free Press. My question today, I'm wondering, Minister, what you make of the province of Manitoba's announcement yesterday that they're planning on putting additional restrictions in place for anyone who's looking to provide addictions treatment, possibly open up a supervised consumption site. they've been seemingly critical of the federal requirements, saying sort of that it's insufficient with the Health Canada exemption. What do you make of this?
Well, as you know, it was just yesterday, and so we will look at it, and I look forward to a conversation with the minister about this. As you know, we are always working to reduce the barriers to people getting to harm reduction. I think that we also are committed to evidence-based approaches, not ideology. And so we, across the country, are working to make sure that when you think of 40,000 overdoses being reversed in safe consumption sites across the country, that those are lives that have been saved. So I have some concern that there is some misunderstanding about the role of harm reduction across the country. I hope that people know that when, as the federal government, we grant a Section 56 exemption, that there is extraordinary due diligence to make sure of the safety, efficacy, all of the precautions to make sure, for example, that if a safe consumption site wants to move from safe injection to inhalation, that they have to reapply because there are serious health and safety requirements to have a hood to make sure that all the people working in that area would remain safe, or the other participants. If a safe consumption site moves down the street, they have to reapply to make sure that all the criteria are being met. So I think that we want to make sure that nothing is increasing the barriers to people getting harm reduction, and that I think that we are working, I think, with from safe supply to safe consumption, that the people on the front line of this crisis need to be heard, but so do people with lived and living experience about what is a barrier and what low barrier services look like. But also I think that the groups like Mom Stop the Harm have been very effective in being able to explain the story of the loved one they've lost, and how they know we have to have bold and significant change in our attitudes to people using drugs.
Thank you. And I'm wondering, with the funding that's been announced today, could any of that possibly go towards funding, say, a supervised consumption site in Manitoba if someone were to apply through the federal government?
So the money that's being has been announced today is for specific projects already, but we do know that that in the $100 million that we received in last year's budget, that, and hopefully more coming. I'm not sure if I'm allowed to say that, but it is that we would be that any group can apply to innovative and creative approaches that actually on prevention, harm reduction, treatment. In some of the ones that have been approved today, whether it's the South Asian Network in Edmonton, Alberta Harm Reduction Project in Stony Plain, Alberta, Rapid Access Addiction Medicine Clinic in Calgary, the Campus Addiction Supports Program in Grand Prairie. Here in Steinbeck, there is the Schizophrenia Society of Canada is receiving almost $1 million over 26 months. The RAM Clinic here in Winnipeg, as well as today's harm reduction. There are also, you can see in the background, are other projects in Northwest Territories, Saskatchewan, and in Yukon. So these are very specific approvals of submissions that have been sent, and then but we are certainly there are many in the queue that we are analyzing and would want hopefully to be able to support.
Hi, I'm Michelle Gerwing from CTV. This is for Kelly. I'm wondering if you will be applying for the license that the province has put in. Well, they announced it yesterday.
No, we won't be applying for that license.
Okay. Maybe explain what the two new harm reduction workers will be doing a little bit more.
It's a peer-led program, so much of our programming hasn't yet been developed. At this point, we have hired our peer harm reduction worker, and so Jacob and I will be working with the peer harm reduction worker to develop the programming. That is a big piece of this program, that we do want it to be peer-led so that the ideas are coming from folks who have some lived experience, who can tell us what is going to work the best for them.
I just want to say that the peer-led, we're seeing such efficacy with the peer-led programming, meaning that a lot of people using drugs have had very bad experiences in traditional systems for health and healthcare, and having a peer who has that lived or living experience is really reduces the barrier to people feeling safe enough to seek help. And so we are seeing it obviously in the huddle model with integrated youth services. Having a peer as the sort of first contact is really making a difference in young people, particularly feeling they're safe enough to come and ask for help. And it's, I think, as we are looking at expanding our understanding of what is the mental health workforce across Canada, that it isn't just people with letters after their name, that some of the people doing some of the most important work are people who have the lived and living experience, or are knowledge keepers, elders, faith leaders, that there are people that are able to help. And so we're very excited to see the kind of success that peer-led programming is doing.
We will now proceed to questions from journalists on the line with Zoom. I'm going to hand it over to my colleague Natalie Mohammed.
Thank you. We will now proceed to questions from journalists on Zoom. If you are a reporter and you wish to ask a question, please use the raise your hand function. We ask that you limit yourself to one question and one follow-up. Please indicate your name and media outlet before asking your question. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Veuillez identifier votre nom et votre média avant de poser votre question. Okay, looks like we have one question here from Brittany Hobson. We'll turn it over to you.
Hi there, thank you. Brittany Hobson, the Canadian Press. Minister, I'm just wondering if there are any plans with the federal government to do with other provinces what has been done in BC to decriminalize small amounts of drugs.
Yes, thank you for that. And I think, as we mentioned, that what is really interesting about the BC exemption has been the criteria that they have been able to meet: increasing health and social services, public education, continuing to work with the stakeholders, working with law enforcement and the training of law enforcement, but particularly the research and evaluation piece. And so where we're really working in terms of going forward, it is looking at those not only public health indicators, but the public safety indicators, because we anecdotally believe that petty crime goes down, the visits to emerge, paramedic visits. So we're going to be able to measure all of that, and then that has been helping other applicants come forward, like Toronto, whose the Board of Public Health has put in an application. We've heard interest from other jurisdictions, but not a formal application yet. The only other formal application we have from Toronto Board of Health. And certainly I have been talking with Dr. Davila, the medical officer of health there, as well as the deputy mayor, McKelvey, as we work hand in hand between their officials and the Health Canada officials to make sure that the kind of criteria that are required for a successful application, that this is just a working together on this.
Thank you, Minister. And a follow-up, Brittany?
Yes, thank you. My follow-up is for Kelly. I'm just wondering if maybe you can expand on how having these two new peer support harm reduction workers will help clientele or the people that you serve.
Well, we do know that there will definitely be greater access for community members for harm reduction supplies. So as a community organization, that is one thing that we have been hearing, that community members are having difficulty accessing those harm reduction supplies, and we all know that those can be really helpful for folks who are living with addiction. As far as I had mentioned previously, the program is still in the development phase, so it's hard to really expand too much on exactly what the effect of the program will be. But we do know that there will also be an emphasis on coordination between the different organizations that do harm reduction work in the West Broadway community. We have many great organizations here doing excellent work. But sometimes there isn't always coordination between the different organizations as we work with community members who are in active addiction. So that is our hope, that we will, A, be able to allow greater access to the harm reduction supplies, and B, do that piece of helping the different organizations to kind of work more collaboratively and more effectively. But that said, yeah, it is the programming is definitely still in the development phase and will be very much influenced by our peer harm reduction worker.
Thank you both. That concludes the questions on Zoom, so I will turn it back to Elaine in the room.
Thank you, and that concludes today's event. Thank you. Ceci conclut l'événement aujourd'hui. Merci à tous. Thank you, everybody.